Hi, my name is Dr. Jon Evans and I work with ProTailored Physical Therapy here in Fort Wayne, Indiana, and I'm going to teach you the best 3 exercises for elbow pain. Stick your arm straight out while you're keeping your elbow fully extended. Take your wrist, bend it down, and turn it away from your body. You should feel a nice pull on the top of your elbow. You hold that for 30 seconds and you do it 5 times in a row. Bring your hand up onto the wall, elbows straight. Get your palm flat against the wall, and I'm facing directly towards the wall. Now I'm going to turn my wrist away from my thumb upside down, and then I'm going to turn away from my wrist. I'm going to hold it there for a second or two. I'm going to turn back, I'm going to rotate my hand back up, and then I'm going to go out to my fingertips, and I'm just going to keep going back and forth for 30 times. And just remember, you don't have to hold it for a long period of time. It's just a matter of moving through that stretch repetitively. We really need to stretch out your bicep. So the best way to do that is put your hand up on the wall, a little higher than your hip, and you just lean towards the wall and you stay perpendicular to the wall. Now you hold this for 30 seconds and you do it 3 times. If you don't feel much of a stretch, rotate your trunk a little bit further. You can also raise your hand a little higher on the wall. So I'm going to teach you guys how to scrape on both the outside of your elbow and the inside of your elbow. We're going to be scraping out here for something called lateral epicondylitis, also known as tennis elbow. We're going to be scraping on the inside of your elbow for something called medial epicondylitis, also known as golfer's elbow. So when we're scraping on the outside of the elbow, we want to put some lotion on. I already did, using the back end of a dull knife. And we're going to be applying gentle long strokes to the biggest part of the muscle belly, which attaches right here. So what we're doing when we're scraping is we're trying to increase circulation and blood flow into the muscle belly so it takes pressure off the insertion point in the bone. Same thing when we're doing it in here. So whenever you're scraping, you're doing long strokes, applying a good amount of pressure, doing this for 30 to 45 seconds. You're going to notice that the color of your skin is going to turn to a dark red. You're not trying to create blisters or do any more damage than that, than just the red tint there. When you do it on the inside of your elbow, you have to be a little bit more careful simply because your funny bone nerve sits right underneath there. So you want to avoid that. So you're scraping across the inside of that forearm, a big even strokes, applying a good amount of pressure. Once again, make sure you put lotion on first. You do that for 30 to 45 seconds. And then you relax and you should notice that your forearm and your elbow feels a little bit more loose. Elbow braces work on about 50% of my patients, so some people do well, some people don't notice a difference. So it's worth giving a try. I'll provide a link below, and when you put them on, don't put them right over your elbow joint. Put it just a little bit further down your elbow, right on the meaty part of your forearm, and then you see how it feels. Alright guys, I hope that information was useful for you. Please let us know if you have any questions, comments, or any new topics that you'd like us to cover in our next video. Also, please like and subscribe to our channel so you can get updated on our new videos that come out. And lastly, if you'd like to schedule an appointment at ProTailored Physical Therapy in Fort Wayne, Indiana, you can call us at 260-739-0300, or you can visit us online at www.protailored.com. Thanks.